Assalamualaikum doctors. In this video I am discussing history Down syndrome. How can we take? So Down syndrome history is very important in MRCPCH. It comes communication, history, development and clinical too much important. So in history how it comes like Down syndrome related any complications. Chief complaints can be Fahad is an 8 years old boy with Down syndrome, known case of Down syndrome, came with his mummy Aura for annual follow-up. So first history of present illness, we will ask about the concern. The child had not increased in height for 2 years. How did you notice that? Any growth chart with you? Down syndrome special chart. What about mom height, dad height? If known to the mother, before this time was he increasing in height normally? Then generally FWASL, that is fever, weight loss or any weight gain, appetite, sleep disturbances, increased sleepiness, mood, emotional disturbance. So Down syndrome is very much complicated with hypothyroidism. So we ask that weight gain, Down syndrome has present or not, increased sleepiness. Any chronic disease, otherwise this Down syndrome, celiac or diabetes mellitus can be present. Any unusual features. What is the features of Down syndrome? A flattened face, especially the bridge of the nose, almond-shaped eyes, upward slanting, short neck, small ears, tongue that tends to be stick out of the mouth, tiny white spot on the iris, colored part of the eye, small hands and feet, single line across the palm of the hand, palmar crease. Then systemic review one by one ask we. First of all, GIT, describe his poo. Constipations, any difficulty of swallowing, throwing up, mouth sores, sores in his back passage, increase in the tummy size, increase in celiac disease. Remember, tummy size increase in celiac disease and constipation present in hypothyroidism. Nutrition is that how many meals he is taken, is there any anorexia present or not, who prepares food for him, amount in each meal, any craving for a special type of food, any growth chart is there. Then CNS about any abnormal behavior, any abnormal movements like tremors or chorea, weakness, proximal myopathy, then headaches, morning throw up, numbness, affected vision, double vision, bulging or edema of eyes, any concern about hearing loss, any concern about hearing, loss of hair or outer part of the eyebrows. So loss of hair, outer part of eyebrows we find in thyroid. Okay. Then we are going the CVS. Heart racing, any fainting episode, exercise intolerance, respiratory about the recurrent chest bugs, cough, tolerance to exercise, recurrent ear infections, snoring sound, adenoid faces and sleepiness in the morning. The urinary about any concern about pee, amount, frequency, how many times he goes to bathroom per night, and did he measure the blood pressure before. MSK, any skin pigmentation, additions, hypopigmentation for vitiligo, skin rash for erythema nodosum, hair loss in the head or eyebrow, nail, joint pain, swelling, any swelling in the legs and feet, that is pretibial myxedema, pains on walking or tingling, atlantoaxial subluxation. Then endocrine, any swelling in the front of this neck, prefer cold or hot, cold intolerance with hypothyroidism. Then hematology is about any pallor like anemia of associated celiac or megaloblastic anemia, any yellowish discoloration of the skin or the eyes, any history of any blood transfusion and any lump. So this point we will ask past history as usual 5T IOA. What is 5T IOA? Like first of all, when he diagnosed with Down syndrome, by whom? How they diagnosed it? What investigation done? What treatment he was given? Is he compliant to the treatment? Which team he is following with hospitalizations? How many times? In which ward and medications? Perinatal history, mother's age at the time of pregnancy, very important asking these questions. Antenatal scan if done and its results. Any simple or other test done during pregnancy, any admission to baby unit after birth, any jaundice. Then vaccination, allergy, that is pubertal if relevant. Allergy pubertal if relevant. Development is in details, expected to have global developmental delay, all about behavior abnormality. Okay. Now, family, are you and your husband a relative? Describe for me your family history of similar condition or any other autoimmune disease, psychological, social, and home. School is type of school performance, attendance, any bullying at school, impact on the family and the child. So, how we take the Down syndrome, I already tell you. So, in when we take the Down syndrome history, we have to keep in mind what are the complications actually occur in Down syndrome. I am telling you comorbidities in a case of Down syndrome. First of all, endocrine problem in Down syndrome. These are screened at birth, that's 6 months and annually. We can be find hypothyroidism, hyperthyroidism, diabetes mellitus, short stature and obesity. Hematological problem in DS. These are transient myeloproliferative disease, ALL, acute lymphoblastic leukemia, it is less than 1 year, acute myeloblastic leukemia, more than 1 year. Cardiac problems in DS are screened at birth, then at 6 weeks, that is VSD, AVSD, ASD, pulmonary hypertension. Respiratory problem in Down syndrome are screened every year, obstructive sleep apnea, recurrent chest infection, mixed hearing loss, but most common in that is conductive hearing loss because of recurrent ear infection. The neuropsychiatric problems are screened for each visit, hypotonia, global developmental delay, and autism. Ophthalmological problems are screened at birth, then at 6 months, then annually, myopia, cataract, glaucoma, Brushfield spots, nystagmus, and strabismus. Gastrointestinal problems in Down syndrome are duodenal atresia, tracheoesophageal fistula, Hirschsprung's disease, annual pancreas, neonatal cholestasis, celiac disease, screening, and 18 months. So these are the problems related to Down syndrome. When we take history, Down syndrome, we should keep this in our mind. And if it is telling that Down syndrome of obesity, causes of obesity and Down syndrome are hypotonia, hypothyroidism, unhealthy diet, decreased level of activity, and increased leptin hormone. Thank you.